Well, Yvonne, this appearance and rise of a new variant just at this moment underscores, I think, that we're at yet a new crossroads in the pandemic. Our roadmap for what happens next has sort of two sets of instructions. One is a COVID narrative that cases are going down, the disease with Omicron is growing milder, and we need to move on and live with the virus as it is. And the reality, the true narrative, actually is quite different. We've just crossed the terrible threshold of about 6 million deaths worldwide. Cases are up in many parts of Europe, way up in the Far East. And the secondary effects of COVID, which we can talk about being termed long COVID, are real and serious. And really, most importantly, we failed miserably at vaccinating the rest of the world, leaving billions vulnerable and the possibility for new variants like BA2. So what do we know about BA2? It's from the original BA1 Omicron lineage, but has additional mutations that make it 1.4 times more infectious. Now, the original Omicron was already highly infectious, so BA2 is now approaching some of the most infectious diseases we have, measles, pertussis, et cetera, in terms of how infectious it is. And it's already, we see numbers, like you've said, Denmark, Sweden, and even India, where it's well above 90%, and in the UK, which has been a bit of a harbinger for other parts of the world, the United States, but also Australia, it's already 60% of cases. So the good news is that the early studies seem to indicate that the vaccines we have are effective against BA2. The UK Health Security Agency came out with some studies last week that showed that, and other studies from Japan and elsewhere show that our monoclonal antibody treatments are still highly effective when it comes to being infected with BA2. There are really many elements of this inaccurate narrative that are out there, and we've started with colleagues from academia, WHO, and the Apiject Global Health Initiative to look at these and pull them together. But for Australia, moving into autumn, we have to see this as a wake-up call. The narrative that the cases are down, COVID's over, and even if I get COVID, I won't get sick is not going to be right.
Well, indeed, cases here in New South Wales are expected to double within 6 weeks. What kind of numbers might we be seeing throughout autumn and winter? How concerning is this, do you think?
Well, the early indications are that we should be concerned in the sense that those that are not vaccinated, just like with Omicron, the original Omicron, are going to be highly at risk. Those that are immunocompromised or the elderly will also be at risk. So that is a big group of individuals out there. We frequently recall cribs if one baby dies. We recall blankets if 3 babies die. The fact that we aren't more concerned about the disease spread when we have a big population of under 5s almost around the world, and certainly even more than that in the developing world, not vaccinated, should be a big concern. And the fact that Omicron BA2 is more infectious even than the original Omicron means that we'll get a high number of cases. Many people won't get severe illness from it, but because it's 5 times more infectious, but even if it's 30% less severe, that still means many people will be in the hospital.
Do you think some COVID restrictions should be reintroduced to curb the spread?
It's quite clear that people put this one narrative of COVID is over, so we need to get rid of all of our public health measures. It's either on or off, but that's not the case. It's quite clear that through the course of the pandemic, we've realized that the damage of schools being closed, of economies being shut down, and businesses being shut have long since outweighed the benefits of the lockdowns. But that does not mean that we can't manage our economies, manage our schools in a responsible way. And simple approaches of masks, hand hygiene, can be reinstated. Now, there's a lot of discussion around kids and masks, and many people with different opinions. A study over a week ago showed 5 million children are orphans or have lost their primary caregiver because of COVID. That is the real damage from COVID to kids, not necessarily wearing masks. So yes, in short, I would be strongly encouraging officials to be looking at numbers and to be reinstating some of these measures as they need to.
And just lastly, and very quickly, unfortunately, because we're running out of time, but what can you tell us about the study that suggests COVID can cause a loss of brain matter?
Yeah, an important study. Really encourage your viewers to take a look at the study in Nature from colleagues at the UK Biobank, where it happens. Tens of thousands of volunteers had a brain scan prior to the pandemic. They were able to compare it afterwards. And it looks from the results that COVID infection did lead to a loss of gray matter, reduced brain size, cognitive decline, even from mild cases. So again, a piece of the puzzle. It's not definitive, it needs more study, but a piece of the puzzle that the effects of COVID don't stop just with the infection.
Good to get a reminder from you about all of this. Dr. Edward Kelley, thank you so much.
Thank you.